Sawasdee Krap, and good afternoon once again. Today is Thursday, the 26th of May, 2022, and this is the English language summary of the weekly press briefing here at the Center for COVID Situation Administration, or CCSA. So, of course, thank you to Dr. Apisamai for the very informative Thai language version of the briefing today. So, just to start off first, as you would know, Thailand is host of APEC this year, APEC 2022 in Thailand this year, under the theme Open, Connect, Balance. Of course, this means a lot of things. It means returning back to normal, having international meetings, hopefully in terms of the physical, more of the physical meetings than online meetings. It is also a reflection of economic revival, resilience, and the return to normalcy in terms of travel, in terms of tourism, in terms of all the businesses that have been affected because of COVID. We'll try to revive and power up all of these issues that have been on stall for the past years. And of course, as host of APEC 2022, Thailand hopes to lead the APEC economies in this regard throughout this year. So first, for the entry requirements into Thailand, I'd just like to start off first by recapping this, which will be, there are requirements which are to be adjusted beginning on the 1st of June 2022. Just to recap this, number one is that all quarantine measures for inbound travelers will be lifted on the 1st of June 2022. All quarantine measures for inbound travelers lifted. Number two, Thai nationals who enter Thailand by air and by land will no longer need to register on the Thailand Pass. This is for Thai nationals. And number three, for foreign nationals, they will still need to register on the Thailand Pass system at the moment with a more facilitated process. So firstly, for fully vaccinated foreign travelers, having to provide the vaccination certificates, minimum of $10,000 travel insurance to cover COVID-19 medical expenses, and a copy of the valid passport. And for unvaccinated or not fully vaccinated foreign travelers, will have to provide the COVID-19 test results, RT-PCR or ATK, issued within 72 hours before traveling, the $10,000 travel insurance covering COVID expenses, and the copy of the valid passport. So on the 1st of June, foreign nationals will still have to register on the Thailand Pass, but with a more facilitated procedure. And of course, as time goes by, we will be having, of course, more relaxed measures for everybody. But the 1st of June, this will apply to Thai nationals first, no longer having to register on Thailand Pass. So we'll go step by step, don't worry. The Thailand Pass QR code will be auto-generated as well. This is new. This will be auto-generated immediately after registration, which will be simpler. It's going to be more simpler and more convenient, and of course faster for all applicants. The airlines are required to pre-check for Thailand Pass QR code prior to issuing the boarding pass to travelers coming to Thailand. And once they arrive in Thailand, travelers are required to go through the usual checks at the airport. For the Thai nationals, of course, as I mentioned, no longer required to register for Thailand Pass. Thailand Pass will function as a pre-arrival registration for foreign travelers, not an approval system anymore. However, of course, until the revised Thailand Pass measure does take effect on the 1st of June, Thais and foreign nationals are still required to register with the Thailand Pass system and seek approval from the system. So that's 1st of June for Thai nationals initially. So moving on to the general situation that we have for today, the overview of the situation in the country. We have an infographic on screen for you. So it's actually good news. In the past few weeks, the new confirmed cases have essentially dropped to around 5,000 on average per day. Today, for example, as updated, we have 4,924 new confirmed cases, as you see in the blue box on the left. Active cases that remain are over 46,000. We have 37 new fatalities. And for the top 10 provinces with the highest number of persons hospitalized. There you have it on screen for you there. Topping that is Bangkok, and then the other provinces, mostly in the central region and in the northeastern region. Now, moving on to the vaccination progress. So far, the cumulative number of vaccination doses administered to people stands at a total of almost 137 million doses. The total number of the first vaccine now is over 56.6 million, making up 81.5% of the total population. Second dose is 75.4% and booster dose 40.1%. And we will, rest assured, continue on this national campaign of ours to increase the number of people being vaccinated with the various doses. On the transition to the endemic status, many of you have been following this. As the daily COVID-19 infections continue to decline, the Health Ministry is now expecting the transition to occur half a month earlier than previously anticipated. So, according to the Permanent Secretary of the Ministry of Public Health, Dr. Kietipoom Wongrajit, the COVID situation is continuing to show improvement, and health agencies thus are being asked to prepare plans for accommodating the transition of the disease into an endemic status sooner than expected. So the Permanent Secretary also indicated that the Omicron symptoms in Thailand have been less severe than the seasonal flu, with most of the infected either being asymptomatic or exhibiting typical flu-like symptoms, and the vaccination coverage has also been increasing at a constant rate. So therefore, more restrictions will be lifted so people can live almost like before, but of course under new normal requirements. Now, face masks will be required in only poorly ventilated areas or crowded spaces, as well as while in contact with patients. And sanitation management at various sites will also remain subject to some disease control measures. So this is actually advanced information for you to prepare. And as soon as Thailand announces that we have transitioned from the pandemic to the endemic status, and the accompanying relaxed measures, be it on congregation, be it on face masks, we'll let you know as soon as possible. But with the situation, with the tide turning towards a positive trend, I think that this will be much earlier than expected. So that's what I can say to you right now. That's what I can tell you right now. Now, of course, with the better situation, we have more tourists coming in. With more relaxed measures, we have more tourists coming in, foreign visitors. That's good news for various provinces. Previously, the sandbox blue provinces, if you recall. Phuket, for example, is one example, eyeing to welcome up to 5 million foreign tourists this year, hopefully, as a result of the relaxation of entry restrictions. And this, of course, would account to almost half of pre-COVID arrivals. So according to the head of Phuket's tourism and sports office, the island province has seen between 2,000 to 3,000 arrivals per day since the Test and Go program was cancelled on the 1st of May. The number is anticipated to increase to around 10,000 per day during the fourth quarter's peak tourism season. Now, on screen you see the infographic courtesy of the NBT World. Up to 5 million tourists this year. That's cumulative total. That's a total number. So you've heard about monkeypox, of course. I'll touch a little bit about that. Will be of interest to the English language audience here. Measures have been stepped up to prevent monkeypox outbreak. As you may see in the news, this outbreak in many countries, in some countries. Just to inform you that additional screening measures are now in place in Thailand for visitors traveling from countries where monkeypox has been reported. So according to the Department of Disease Control, or DDC, travelers coming to Thailand must now fill out and present a health declaration card upon arrival in Thailand. The card, which contains a QR code, allows officials to keep track of each passenger and provide appropriate medical care in the event of an emergency. Now, the DDC has established an emergency operations center to monitor the spread of monkeypox in particular, and instructed related units to be vigilant for travelers from certain areas of the world. This includes in Europe and in Africa as well. So the UK, Spain, Portugal, and in Central and West Africa. These are where the virus has currently been detected. And according to DDC officials, any visitors exhibiting signs of illness will be transferred to the nearest hospital for testing. The Health Ministry's director of the Epidemiology Division said that the Emergency Operations Center, or EOC, will assist in screening tourists who may have been exposed to the virus. And he explained that during the incubation period, infected individuals may not exhibit visible symptoms, such as rashes or raised spots that transform into blisters and scabs. So during the incubation period, that may not be visible. Monkeypox symptoms, of course, include fever, headache, muscle pains, backache, swollen glands, chills, and fatigue. And they also resemble those of smallpox, although the symptoms are typically less severe. Now, just in terms of terminology first, according to the DDC of Thailand, actually it shouldn't be called monkeypox, as the main agent of contagion are not primarily monkeys, but rather rodents. So basically, this is the recap I have for you today. Just in closing, encouraging everyone to get also an influenza shot, influenza vaccine, which is available, of course, in hospitals in Thailand. As Thailand has, as you know, has already entered our rainy season, which may cause a rise in the infections of influenza. So this vaccine for influenza will lower the chance of severe illnesses and fatality. And the influenza shot can be given at the same time as the COVID-19 vaccine by inoculating different arms, meaning left arm, right arm, which will lower the chance of getting infected with both diseases. So very, very important of preventing the spread of influenza as well as COVID-19, as well as, of course, monkeypox. Imagine the things we are facing today in Thailand as well as around the world. It's a common threat, a common risk for everyone around the world right now. And we have to, of course, stay safe and keep each other healthy. So thank you very much for your attention today. We'll see you again next week. Have a pleasant weekend ahead. สวัสดีครับ